Oh, this is crazy.
Oh my God.
Oh, wow.
This holiday season, give yourself or someone you love the gift of a lifetime of smiles. If you're struggling with pain or embarrassment because of your teeth, don't let another holiday pass you by.
How long has it been since you had a nice smile?
30 years.
30 years?
It's amazing. It's absolutely amazing.
Good evening, everyone. Thanks for sticking around. We apologize for that delay, but we are up and going now. So thank you for joining us for our webinar tonight. My name is Bianca, and I'm here with Dr. Richards, and we are excited to explain all things dental implants and answer any questions that you have tonight. So if you do want to ask a question, if you're streaming or watching on YouTube, you can type in a question right on the chat box and we can read that and answer that. And then if you're on GoToWebinar, there should also be a chat box for you to fill out. If you don't see the chat box, there's a little orange arrow in the right-hand corner of the screen. You can click that to pull that up. But we're going to go ahead and get started. How are you doing tonight?
Doing well, thanks.
Good.
Looking forward to it.
Yeah. So to kind of jump right into things, let's learn a little bit about Dr. Richards. So he is a board-certified oral and maxillofacial surgeon since 1982. So he has over 40 years of dental implant experience and is an innovator of new teeth now. And Dr. Richards, can you kind of explain why you feel this specific procedure is so important to provide for your patients?
Well, you know, we see a lot of people that are in severe need of what we do. And the age ranges, interestingly enough, from in the 20s to the 80s. And we see a lot of people that have a mouthful of bad teeth, driven by fear of going to the dentist. They know things are bad. They are fearful of what they're going to hear and fearful of having anything done. We see people with no teeth who are miserable in dentures. We see people who have severe periodontal disease where their teeth are good, but the supporting structures have deteriorated and they're going to lose their teeth. We see a lot of young people this way. And I'd say that's the majority of the people we see, people with a mouthful of bad teeth, people miserable in dentures, and other people who are miserable with end-stage periodontal disease, and they're going to lose their teeth, and they're scared to death to lose their teeth. So, you know, we see a few other, you know, weird kind of things, but those three are the most,
main ones,
yeah, the main. And, you know, it's kind of interesting because it really is a life-changing experience to go through what we call new teeth now. To come in the morning, as you know, come into the office in the morning around 7 o'clock, meet the anesthetist, go back to the OR, get put to sleep, wake up. 3 hours later, they have a full set of teeth in their mouth fixed, screwed in to the implants. And these are not the final teeth. They're temporary bridges. And you know, a lot of people just literally cry. They're so happy.
Yes.
You know, it's really
So life-changing.
really moving. And you know, if you're not in that position, it's hard to imagine, you know, what it must be like. Those of us who have our own teeth. So, I'd say that, you know, pretty much wraps that up about who we're appealing to and who we're reaching out to.
Yes, so we're going to start off with just some good visual examples so you can get to know what an implant is. So with the fixed upper hybrid, what are our viewers looking at here?
Well, we're looking at a fixed bridge on dental implants, and the hybrid, to me, refers to a situation where the implants and the teeth are sort of disconnected. The teeth attach to the implants, but the implants go where the bone is. The teeth go where the teeth need to be in the person's mouth and face so that they look good, and it all comes together. And so that's the hybrid portion, as opposed to a bridge like a dental bridge on implants, where the implants have to go exactly where the teeth were located. to have the bridge to restore the area where the teeth are missing. And so these work well with severe bone loss from periodontal disease. These work well with severe bone loss due to trauma, severe bone loss due to the wearing of dentures over 20, 30, 40, 50 years where the bone's gone, and some of these people come in and their dentures are like that thick, you know, because the teeth need to be down here and the bone's way up here, or the bone's way back here and the teeth need to be out there. So, you know, we see a lot of situations, and so that's the hybrid part of it, at least my way of thinking, is that the implants go where the bone is, the teeth go where the teeth need to be, and it all kind of comes together.
Yeah, that's a perfect explanation. And the lower hybrid, it's similar in concept.
Essentially the same thing.
Yep.
In the lower, of course, we're working around the what's called the mandibular nerve. The mandible is the lower jaw. It's the medical term for the lower jaw. There's a nerve in the jaw, and the nerves comes out of these little holes that are about the area of the corner of the mouth and supplies the feeling to the lip and the chin. And we're working around that nerve in the lower jaw. In the upper jaw, we're working around the sinuses, which are air-filled hollow cavities that offer us no benefit because we can't put implants into air. We need bone, and we don't want to go near the sinuses because it's only air. So we end up tilting implants a lot in the lower jaw and the upper jaw in order to facilitate getting an implant as far in the back as we can without having to do any bone grafting. And that's where zygoma implants come in, very helpful in our practice. We do a lot of zygomatic implants, and I'll talk about those in a few minutes as we kind of get into this.
So kind of, Dr. Richards briefly explained this about the day of surgery, but to kind of just go over it in stages. So you'll come here in the morning, you'll be put in a deep sleep with general anesthesia for a pain-free procedure. So lights are out, you're getting surgery. If you have teeth, they are first extracted, and then all of the implants are placed. And then while the patient is still asleep, we'll take impressions for our in-house lab to then customize the same-day teeth. And then the patient will wake up in a private recovery room while the in-house lab is creating those teeth. And finally, at around 4:30 p.m. or so, the teeth are placed in the patient's mouth and adjusted, and you are free to go home at that point with your temporary set. So, you know, a lot goes...
You make that sound so simple.
A lot happens in one day, but that's the 6 steps, essentially.
You know, and each of those steps has to be done properly.
Yes.
Each step is easy, but if it's not done correctly, then which step is it, that slide you just had up here?
Yeah.
The 6th slide number 6. If the impression is not done correctly, then when you get to slide 6 and the teeth don't fit, it's kind of a downer.
Yes.
So
everything has to happen in order for the whole day to go smoothly.
Yes, luckily for our clients, people who come to see us, this is what I do every day. And I've pretty much given up taking out teeth and wisdom teeth and all of that, and all I do is this every day. And so that's what our business model is set up to do, our in-house lab, and we've just expanded that, and we're going to show you some pictures and talk about that in a little bit. But you know, if you want to have heart surgery, where do you go? Do you go to a country bumpkin hospital where they might do one, or where they can't do any a year or a month, or do you go to Tampa General Hospital or Orlando Regional Medical Center where they do maybe 5, 6 a day or more? I kind of look at that with this procedure because this is what Dr. Kirkpatrick and I do every day. This is all we do. We specialize in full arch, full mouth reconstruction. So, you know, if this is what you need, I think by the end of this webinar, or if you've watched previous webinars, you would know that this is where you should come to have this type of procedure.
Exactly. And our model is also, it's all in one day, but it's also all in one office. So our surgeons, our dental lab, and our restorative doctor are all under one roof, and that's to better serve our patients, have more efficient communication, and it's just all around the best practice that we've seen for great outcomes.
Right, right. Yeah, and the great outcome, I mean, that's what it's all about. We built this office for the great outcome. This office we moved into in 2002, the major portion there. And then in the rear left is the lab and prosthetic center and 2 operating rooms that we added on in 2013. So we've got about a 16,000 square foot office. We just outgrew the labs so quick, I can't believe it, that we had to go off-site to put in a new lab, which we have some pictures of here in a few minutes, to be able to keep up with the volume of what we do. So it's been an interesting ride, really, over the 42 years. I think the first full mouth I did back in the day, early 80s, 83, 84. My father was a general dentist here in Lakeland, and we started doing these together. The Brandemark implant system was approved by the FDA in this country somewhere around 83, 84, 85. We started using that and started doing full mouth. Kind of hooked up with Mike Howard, who owned Crown Dental Lab here in Lakeland, and we did teeth in a day, teeth in 3 days, teeth in a week, teeth in a month. I mean, we did teeth every which way you could do it. And what we're doing today is really a culmination of 40 years of experience. And then, of course, the addition of Zygomatic implants just totally revolutionized what we're doing today, because we can take people who have no bone in the front, no bone in the back, and we can do Zygomatic implants, and they can walk out of this office with fixed teeth, fixed non-removable teeth the same day, with no bone in the front and no bone in the back, using Zygoma implants. So Zygoma implants really have sort of revolutionized the business, and both Dr. Kirkpatrick and I started doing those back about 06, 07. So, we're about 15 years into Zygomatic implants now, and we're told we do more here than anybody in the country. So, he and I each do probably 10 a week. We do a lot of that for people that have no bone. So,
we're gonna watch a video about Kim, and she had periodontal disease, missing teeth, and was very careful when smiling. And then after we talk about Kim, we will jump into Zygomatic. So let's hear Kim's story.
Thanks to New Teeth Now, I have 100% confidence in talking to people and meeting new people. It is definitely Disney World for adults down here. There's so much to do, and there's so much interaction with people. When you feel good about yourself and you have nothing to hide, your social life and your social existence is so much more valuable to you.
Kim and I have been married for it'll be 32 years in another month. For as long as I've known her, she has suffered with these periodontal disease.
So I was constantly had issues with my teeth. Slowly but surely, my teeth still started to deteriorate and fall out. You could see that I had missing teeth. I always had to keep in mind that I shouldn't be smiling too wide. I didn't want people to see that I didn't have teeth in the back of my smile. There are certainly times that I could see it on somebody's face. They're thinking to themselves in their mind, why is she missing teeth? It was very embarrassing, because I knew that I had to research and come up with a permanent solution. I wasn't going to fool around anymore. I didn't want partials, I didn't want bridges. So one day I saw a commercial on TV, get new teeth in one day. I thought to myself, well, it's worth a shot going in and doing a consultation. Before I left, I had made up my mind that that's what I was going to do. I was going to have it done by Dr. Richards, and I was going to go to New Teeth Now.
At New Teeth Now, we've helped thousands of people regain their health, happiness, and confidence, and we can help you too in just one day.
So I think the whole process wasn't more than 4 hours. I was thrilled. I had a new set of teeth. They were absolutely amazing. And we went home. I did not have to take a pain pill, not one pain pill. It was amazing. Just think about having one tooth pulled out. I remember having teeth pulled out and experiencing a lot of pain. But Dr. Richards was right. I did not experience that much pain. I told my husband we're gonna go out and I'm gonna have my filet mignon. And it was a memorable meal. It was delicious.
She's definitely, you see her more confident. She smiles bigger now than she was smiling before. And right now, her teeth look fabulous. They're permanent in her mouth. It's just a wonderful solution. I couldn't think of a better solution than what she's going through now. I'm thrilled with it now too. Look at a beautiful smile she has. Yeah.
I just wanted to really thank Dr. Richards. He really gave me the confidence to move forward with having this process done. And everything that he said he could do, and everything that he said would transpire has happened, and I couldn't be happier.
So Kim, as you can tell from watching that video, she is fully confident, and meeting and talking to new people is very easy for her now, and it's just incredible to see that change.
Mm-hmm. Something.
So we'll kind of go into the differences between traditional implants and then zygomatic
implants, right. So what you're seeing on this slide is just a sort of a routine, everyday procedure for a full mouth. The top row of implants, that top row is in the upper jaw, and the far left and the far right are tilted forward to avoid the sinus. Now the bottom row of implants, that's the lower jaw, and they are also tilted, the far right and the far left, and they're tilted to avoid the lower jaw nerve, the mandibular nerve. And so the typical layout would be 6 implants in the upper jaw, unless it's all zygomas. If it's all zygomas, it's 4 zygomas. In the lower jaw, typically 5, maximum of 6, maybe 5 with a couple of spares in the back, 6 with a couple of spares in the back. It just kind of depends on how much bone that each individual has of what we do. Our fees are not set up to charge by the implant, so we have the ability to put as few or as many as possible. We don't have to worry about the fee going up, because it's kind of a universal, all-inclusive fee.
Yes, which is really nice for you to be able to do what needs to happen.
Right.
Yeah.
So we've got some pictures of some zygomatic implants. Basically, the zygoma is your cheekbone, and the zygoma implants go from the jawbone to the cheekbone. And there's some specific reasons that we use zygoma implants. And we use them when the sinus is a problem and will not allow us to use tilted implants. We use them when the bone is very thin, sometimes 2 or 3 millimeters thin, which would not allow us to place a traditional implant. So sinus issues, sinus coming too far forward, there being no bone, or there can be good bone vertically, but it's very thin. So there's some specific reasons that we use zygomatics. And when we use, and this x-ray shows 4 traditional implants in the front area of the upper jaw. We're looking at that top row of implants again, where there are 4 in that top row in the front, in the middle, that are traditional, and then a zygoma on the far left and the far right. And zygomas are only in the upper jaw because they go to the cheekbone, and the cheekbone's up there with the upper jaw. There's no cheekbone with the lower jaw. And you can see in the lower row of implants, they're 2 tilted with 2 straight and a couple of extras. So that's a setup for 6 because that person had enough bone for that. So that's a very typical case. When you look at zygomas, that is typical. 2 zygomas in the back, 4 traditionals in the front. So when we do zygomas, that is the most common application. We have another Halloween picture of 4 zygomas. We have another picture of 4 zygomas. Is that going to come up? The 4 zygoma
I'm
one?
so sorry.
There you go. Bianca needs a cup of coffee, I think. Anyway, this is an illustration of, it's the actual x-ray of a post-op x-ray of a person with no bone in the front, no bone in the back. We're talking about the upper jaw because there's natural teeth in the lower there. And so there's 4 implants, all 4 zygomatics. And there's typically only room for 2 zygomatics on each side. And these are very strong. The Zygomatic are the strongest implants that we place. They're a little more technical, but they're very easy to place. We've done a whole bunch of them, a lot. And they work out very well. There's a pretty steep learning curve. We're way out beyond that and have perfected our technique to where we rarely see any problems with our zygoma implants. Now this is an x-ray, and I'll draw your attention to the top row of implants. And once again, this is 4 zygoma implants, but this person had some extra bone in the front so that 2 traditional implants were placed to supplement the 4 zygoma implants. And so what's kind of interesting about this is that these people find us. They come from all over the country and they find us. And a person like that x-ray that you were just looking at right here, this person will come in and they may have been to 4 or 5 people out in wherever, Pennsylvania, New Jersey, New York. And they hear about us and they call, and the call gets picked up by our call center and they talk to someone and they actually come down. And we talk to them and say, yes, we can do zygomatic implants. And so we take a person who's been around getting consults, they've been told they have no bone, they can't have any implants, and we put in a minimum of 4 zygoma implants and sometimes a couple of extras. So, you know, they get 4, 5, or 6 implants,
Yes.
and it's like blows their mind. It also blows our mind because it's so easy. But I don't know why zygoma implants have not really caught on since we've been doing them 15 years, 16 years. They work really well in our hands.
Yes.
So quad zygomas, double zygomas. Occasionally we'll do a unilateral single zygoma in the upper jaw. So it's just another tool in the toolbox. And the advantage of the zygoma is no bone grafting. I think we talked about that earlier. No bone grafting.
Yes.
You can hook teeth to the zygoma the same day, no bone grafting, no waiting, office procedure, no bone grafting. That is a big deal.
It really
You
is.
do not have to have a sinus bone graft in the back to have a zygoma implant. And we attach teeth to them the same day. So it's really a big deal. One of the 6 differentiators for our practice is we do our procedures under general anesthesia. And so Dr. Kirkpatrick and I are licensed because of our training to administer general anesthesia. And so therefore we are able to supervise CRNAs, Certified Registered Nurse Anesthetists. So these are advanced nurse practitioners. And so all of our full mouth cases are done under general anesthesia. And that's with a breathing tube through the nose, down and the person is maintained under general anesthesia throughout the procedure. These procedures, for even us, that we do these every day, even us, they are 3.5, 4 hour procedures. We've heard some horror stories where in some general dentist offices they're 8 and 10 hour procedures, and it still doesn't work out. So for us, we do this every day. These are 3.5, 4 hour procedures. Now the benefit of general anesthesia is we can get in there and work, and there's no stopping for spitting and gagging and choking and those types of things. When we're irrigating, we irrigate a lot. We use irrigation that has antibiotic mixed in with it. And so the general anesthesia protects the person's airway, so you're not going to drop any little screws and pieces and parts or implants or drivers. Nothing is going to get dropped down the windpipe or the esophagus, the swallowing tube. Everything's protected. The person who's having the procedure done, it's the lights go out, the lights come back on 3.5 hours later, and they're done.
Yes.
So leading up to the general anesthesia, we get medical clearances on everyone. Well, if somebody comes in and they're under 40, under 45, under 40, and they have no history of any heart, lung, liver, kidneys, seizures, any kind of medical issue, then we'll get labs and an EKG. But anybody else who's a little older, who has a doctor, who's taking medicine, we get a formal written medical clearance for general anesthesia. And so if there are medical issues, it's going to come up
Right.
during that getting the medical clearance process. And so, you know, that's just the way you have to do it. If you go to an outpatient surgery procedure to have a colonoscopy and you've had a heart attack or you had a stent, then the GI doctor is going to have a medical clearance
Right.
before they do that. My wife just had anterior cruciate ligament repair on her knee, and she's healthy, and she had a medical clearance from her physician, which involved labs and that sort of thing. So we get medical clearances on everyone who undergoes these procedures. I hope that answers that question.
Yes, I think definitely. We do have a few more that just came in.
Okay.
So I had a very horrifying experience with a dentist. Many issues with my gums, probably periodontal disease. Will I know what is needed and the cost after my first visit with new teeth now?
Well, the answer is yes, because our cost is, we sort of have just a cost. It's like all-inclusive resort cost. It includes everything. If you have teeth that need to come out, it includes that. If you don't have any teeth, it doesn't matter. If it includes the anesthetist, it includes what I do and what Dr. Kirkpatrick does. It includes what our lab does. It includes the first set of teeth that we put into your mouth on the day of surgery. It includes all of the checkup visits, and it includes the final teeth that are made here in this facility by our full-time restorative dentist. So we have 2 full-time restorative dentists. You might hear from one later if we have a video. And so, yes, you will know. We have people coming from all over the country, and we have to be able to tell somebody who's coming from wherever what it's going to cost. And so we just have a cost, and that's what it is.
Yes. So that's perfect. Do you use Zygomatic implants for severe bone loss in lower jaw too? I have smoked for 3 years. Oh, so this is like a 2-part question. So the second part is smoking. Will I need to quit smoking before or after a full mouth restoration, and how long?
Okay, the first part was Zygomatic implants, as I said earlier, are only, they go into the cheekbone, and the cheekbone is connected to the upper jawbone. So zygoma implants are only for the upper. We don't do zygoma implants in the lower. In terms of smoking, you ought to stop anyway. I mean, it'll take 10 years off your life. So, but do you have to stop smoking before you get dental implants? No. But you should stop smoking regardless of whether you're going to have dental implants or not. Just make a decision to see if you can do it. But you don't have to have dental implants. We've done many people who smoke. You know, in regard to that, when you start looking at risk factors, if you smoke and that's all, you don't have any other risk factors, then that's good. But let's say you smoke and you also have some other medical problem for which you're taking prednisone. So that's kind of another risk factor on top of the smoking. And let's say you have some other medical problem like osteopenia, where you're taking Fosamax, and so now you smoke, you're on a steroid, and you're on Fosamax. So when you start stacking these risk factors on top of one another, that's where you have a problem. Not just one thing, typically.
We just spoke with a patient a few weeks ago, and he said he did quit for surgery so that it could heal properly, but then he ended up like actually quitting. Like he just
so
I
think we
pretty
see
cool.
a lot quit.
Perfect. Okay. So even though every precaution is taken prior to surgery, are there contingencies in place in case something goes wrong, like an unexpected adverse reaction to a medication?
Sure. Dr. Kirkpatrick and I both are on the staff at Lakeland Regional, and if a person had some sort of issue with anesthesia, then we can admit you to the hospital if that's necessary. Haven't had to do that, but we can certainly do that. Absolutely. Plus, you know, we all have taken ACLS, trauma ACLS, pediatric ACLS. We just finished all that, and so, I mean, plus our certified registered nurse anesthetists are here. Between the two of us, we're all, you know, experienced in dealing with anything that would happen. We've been very lucky. I'm not even going to knock on wood because I don't want to go there. We've been extremely lucky. In my entire career, have never had a death or anything like that. So, you know, it's been a pretty good run. And I think it's because, you know, we're careful. We get medical clearances. And, you know, while we're talking about that, why don't we talk for a minute about the training of an oral surgeon versus the training of a general dentist who takes a weekend course to place implants. Because we now see more and more people coming in for consults, and they have been around to 2 or 3 places typically. And they've been maybe to a general dentist, maybe to another oral surgeon, maybe to a periodontist. But nevertheless, you know, they've been around and they've been told certain things. And, you know, a lot of times the information that they have been given is not accurate. Like some people are told they don't have enough bone to have implants, when in fact they could have 4 zygomatic implants. I mean, that's an example of that.
Yes.
But out there, it really is kind of a buyer beware thing nowadays. I mean, you've got people like us here. We're board certified oral and maxillofacial surgeons. So we did dental school plus minimum of 4 years in a hospital-based residency, you know, doing rotations on medicine and cardiology and anesthesia and that sort of thing, as opposed to a general dentist who takes a weekend course to place implants, and you might be his first client. So you have to be very careful who you go to see. There's a lot of advertising, and everybody wants to kind of get into this game. So I'll just throw that out there without stepping too hard on anybody's toes, that there are big differences in training between a board-certified oral and maxillofacial surgeon, and there's lots of board-certified oral and maxillofacial surgeons. Not all of them do what we do, and there are board-certified oral and maxillofacial surgeons that focus on trauma, that focus on temporomandibular joint surgery, that focus on head and neck cancer surgery. They do stuff that we don't do, so, you know, people find their own little niche. But when you're dealing with board certified people, at least you can feel comfortable that some standard has been met.
Exactly.
If you go to get a full mouth reconstruction by a general dentist, you don't know anything unless you ask questions about, you know, their experience level. So
yeah, so doing your research, ask questions. That's really making sure you feel comfortable and confident with what a serious procedure that you're going to have.
Which leads back to the untoward reactions and who's prepared to take care of that. Who's prepared to take care of a complication from placement of an implant? If Dr. K and I place implants and we have a complication, we take care of it because we don't have anybody to send them to.
Like there's no one higher up to send.
We are
Yeah.
at the top of the food chain.
Yeah.
Okay? And so we see everybody else's problems that they don't want to take care of. So, you know, there's a lot to think about when you're selecting a provider to do a certain procedure, and you really need to do your homework. I think we can leave that at
Yes,
that.
that's perfect. So yeah, our key differentiators, which we touched on right here, so board certified oral surgeons, zygomatic implants, and general anesthesia. Those are the key things you could be looking out for when you're searching for your provider, and ask those questions to your provider when you're looking around, just to make sure you're getting the best care possible.
Let's show the new pictures of the lab.
Yeah, okay.
Yeah, how far are they?
We're gonna skip ahead real quick, guys. We'll go
Okay.
right back.
We put in our initial lab here in 2013, and we just really way outgrew it. And so we
Here we are.
acquired a small house and we remodeled it because we ran out of room in this office, and we're moving this team that's doing this and who makes all of these videos that you have seen. We're moving this team, our marketing video team, to an outside facility. And then our lab, we acquired a lab from a person who retired. And in the middle picture is Jack Garcia, Senior Jack Garcia, who is our lab manager.
Yes.
And we just received some equipment. So we've got these. On that left slide, those are milling machines that mill out the teeth. When we get to talking about the zirconia teeth, they're machined. They're not handmade. They're actually machined and milled. And these are milling machines that can handle the pucks that go into them that the teeth are milled out of. These can handle multiple pucks.
But with the dental lab you'll see in the video I'll play, they are still right down the road, and we still have an in-house facility. So we still have that communication that's really required. But fortunately, we just have a bigger team.
Yeah, we're still doing our same-day conversions, making the temporary first bridge work. We're still doing that here in the office.
Yes.
And the final zirconia teeth are being done down where the milling center is, where they're milled, and then the porcelain is put on there.
Right. So we are going to, so the restorative team, these are our restorative dentists that we work with every day, Dr. Nafala, and then Dr. Dibbs and Dr. Sorrento. Dr. Dibbs and Sorrento are in-house with us, so they're full-time with us. And so these are, one of them is who you'll meet when you decide to, create your teeth. And we'll watch a quick video with Dr. Dibbs explaining his work and how he works in collaboration with the lab.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So yeah, it's incredible to see how the lab works with our restorative dentists, and we're super excited to have a bigger facility to help more patients. And for this photo, I just love talking about to kind of show you why we use zirconia final teeth. So the teeth that are sitting on the top right there, those are zirconia teeth. The bottom teeth that you see, those are acrylic. Both sets of teeth have been worn for 5 years. And you can see the difference, like as clear as day. How the acrylic teeth, they just kind of look worn out. They kind of absorb those stains. They just look, worn down. The zirconia teeth, though, they look brand new. You wouldn't even think anyone's ever worn them. And that's the quality difference of why we always choose zirconia for the final set. They not only do they reflect natural light like natural teeth do, but they shouldn't chip or crack. They are very durable, and they are designed to last you the rest of your life. So I just love showing that difference because that's a very clear difference of why you just want to choose zirconia. And these are our implant coordinators. So we have Allie, Shauna, and Mara. And if you decide to come in and see us for a consultation, you will meet with one of these wonderful ladies. They have extensive backgrounds in dental and oral surgery, and can really walk you through the whole process step by step, answer all your questions. So they're just fantastic. And at your consultation, it's about an hour to an hour and a half appointment. So we'll first take a CT scan. You'll meet with a coordinator, develop a treatment plan. Dr. Richards will see you as well, go over your specific case, answer any questions. So it's really, really comprehensive. You'll leave knowing, hopefully, having all your questions answered, knowing a lot more detail about the procedure and your specifics, as well as your specific treatment plan. And this is, can you kind of explain why we use the CT scan with the thickness of bone and stuff?
The CT scan, it would be like having a camera and taking a picture of yourself from the front, from the side, from the top, and then being able to take those pictures and put them together and slice them all up so that you can look from different angles. And that bottom right series of 2 rows of 4, these cross-sectional slices, they are the most helpful slices. The one above it is just sort of a flat film called a panoramic survey, and they're nice, but you can't see thickness. And we are interested in the sinus, and we're interested in the thickness of the ridges of the jaw. And the CT scan has really kind of revolutionized the information that we have before we go into doing a procedure.
Yes. So that's why we, instead of an X-ray, we prefer CT.
Yep. CT is an X-ray,
Yeah.
but it's
like more in depth.
Yeah, it's a digital X-ray. The radiation is extremely low.
And to kind of go over the overall process, so let's say you're ready to move forward, you call, you schedule a consult, you come in for the consult, and you're like, all right, I want to get new teeth now done, let's go, let's do this. So next you'll come in for a pre-op and impressions appointment before surgery. So that's where you're actually going to work with the restorative dentist in like picking out what you want your temporary teeth to look like. And then you'll have surgery day, which we discussed, in the beginning of, 7 a.m. to about 4 p.m. that whole day. And then you'll have a set of post-operative appointments following surgery to make sure everything's healing properly. If you need any like small adjustments, we'll take care of that. And then once your implants have fully healed, so they're fully integrated with your bone, then we create the final teeth. You can also make changes at that time to your teeth. If you, we kind of call it like a test drive set.
Yeah.
So if there's anything that you noticed in that healing time where you're like, actually I want them whiter, or I want them a different, shape, something like that, we can make those changes for your finals. So by the time you get your finals, you are completely in love with your teeth. That's our goal. And we're gonna hear from London. So his adult teeth actually never grew in. So he was one of our youngest patients. He was 19 when he had this procedure done. He wore a snap-in smile, which kind of like popped over his teeth and it didn't function well. And he had embarrassment growing up. So we're gonna hear from him.
There's no fear now. These teeth are so strong and durable that I don't really worry now.
It just was nonstop hospitality. You wouldn't have thought you were at a dentist, I'll tell you that. You would have thought you were at a 5-star hotel.
So I first found out I had a problem with my teeth at around 3rd grade. And then I started to lose teeth around 4th grade. I was in the cafeteria and I took a bite out of my cheeseburger and my teeth just came right out into the cheeseburger. And in front of my friends was this little insecure kid.
Being that insecure and self-conscious will affect you in so many different ways. Emotionally, physically, everything. It will affect you and it will change you.
And I went to dentist after dentist after dentist, and they told me, I'm sorry, we can't help you.
We've been to many, and never have I ever experienced anything like I've experienced with new teeth now.
The first time I met Dr. Richards, I had my doubts. I walked in there knowing that he's probably going to say, I'm sorry, we can't help you. But he didn't do that. He looked at me, and he reminded me of how many patients that he's done with bone loss, and he assured me that he could get plenty of implants in with plenty of support and it wouldn't be an issue.
He made me feel so secure. I only met the man one time and knew that this is where we were going to go and who was going to perform this procedure on him.
And I almost felt like I was in a dream. Like, this is exactly what I've pictured ever since I was young. And he really just made me feel comfortable and just relieved that, it's possible for me.
From my perspective, you'll get traditional implants in the front, and you'll get some Zygomatic implants in the back. We did one just about like this yesterday. You'll have a set of fixed teeth this afternoon without any bone grafting. You will not have to take those teeth in and out.
Oh my gosh. Oh, this is crazy. Oh, I don't even feel like I'm looking at me. Oh my gosh. Oh, this is so insane. Oh wow. I don't even know what to say. I just feel like there's a different person in the mirror. The biggest part about these is not being able to take them out, not having something that can come out. Because there's so many times in my life where, they've almost fallen out, and
that's all gone.
So I don't have to worry about that anymore.
Yeah.
And I don't have to hide anything.
Sign of relief, joy, all the heartbreak and the heartache left in a sense. And all I felt was just gratitude.
This is always what I pictured, that there was going to be somewhere I'm going to go when I'm old enough, when I'm 18, and they were going to completely do my teeth and make the smile exactly how I imagined. And now that I have my teeth fixed, I feel like I have so much ahead of me. First things first is college, because this whole entire time I've been doing online classes up until I got my teeth fixed. And so I get to go into college with confidence and take my classes and make new friends and not have to worry about that. I can go to the basketball court and play basketball without any issues and not have to worry about them falling out, not have to put some type of glue that's super hard to clean out at the end of the day. This one is a really big deal. I went on a roller coaster the other day. I made sure to just smile through it and have my mouth open and just like let myself live like a little bit. And that's one of the biggest things, just that new confidence and not having to worry about them falling out and just experience life at like my fullest.
Our mission at New Teeth Now is to help patients overcome severe, long-term dental problems. We've helped thousands of people regain their health, happiness, and confidence, and we can help you too.
The teenager I knew had now suddenly blossomed into a confident, happy, secure young man.
New Teeth Now really did like change my life completely, and I just have so many plans for the future, so much hope again, and that's something I'm so excited to explore. Really.
So you can see the incredible difference. You know, London's set up for a really bright future. He doesn't have to hide his smile anymore. He got Zygomatic implants.
Got Zygomatic implants. And I think the, you know, the take home on that is that something that we do every day that we don't even think about that much, you know? I mean, it's routine, it's not that hard. And it can make such a profound impact on somebody's life, on his and his mother. You saw the reaction when the first set of teeth were put in. So it's, you know, it really is humbling to have that kind of job where you can do stuff like that has such a profound impact on somebody's life.
Yeah, it's really, truly incredible. And we're just gonna go, so this is Bruce. He's from Orlando and he had extreme pain. That's probably one of the only things we didn't really touch on today, is just our patients that suffer from a lot of dental pain, and they can't eat the foods that they love either. So his biggest change was that he could just eat whatever he wants, and that's just something that you don't really think about until you have pain and you can't eat the food you love, and you're like, that's what you want. So it's awesome for Bruce that he can eat anything he wants with his new teeth. We really appreciate you taking the time to be with us tonight. Please give us a call tomorrow. You know, message us online, message us on Facebook, whatever, any other questions that you have, and we're super happy to speak with you. So I hope everyone has a wonderful evening. Good night.